Gentlemen, what do you think about the current push for people to wear masks? Is that effective, or does that create more risk in certain situations?
I don't think the masks are helpful unless it's someone with an active infection and a physician is coming into direct contact with. I think they do more harm than good. And if you properly prophylax patients, it should not be an issue.
And Richard, thoughts?
Well, I think the issue on masks takes into consideration a couple of different points or things to consider. If you're infectious, if you're coughing and sneezing, then by all means, you don't want to be coughing and sneezing on people. But I'm not sure that wearing a mask does that. I mean, I really thought that we had taught this by second grade, where kids realized that if they were coughing or sneezing, they should cover their cough and sneeze and not spread it to other individuals. And if you coughed or sneezed on something else, you cleaned it up. That's second grade stuff. That's not something that is protected with a mask. I mean, we've all seen people with these masks coughing and sneezing, and you see this stuff come out. If you're coughing and sneezing, you shouldn't be around other people to cough and sneeze, whether it's COVID or anything else. So the question is, if you're coughing and sneezing, just don't do that on other people. You should be taking care of yourself. I mean, doctors get criticized for this all the time. Stay at home, don't expose other people, get plenty of rest and fluids, and take, something to help with the pain or discomfort or temperature. And, we get criticized for doing that, but everybody should wear a mask, including if you don't have a problem that you know of, is not addressing the target problem, which is spreading the virus. There have been studies that have been done that have looked at whether viruses coming out of the mouths of people without particulate matter, water droplets or something else, will that in fact get through the virus? And the answer is the pores, the openings of these masks are larger than the viruses, so they do not trap the virus. These masks are designed to drop things that are larger, to block things that are larger, like water droplets and sneeze droplets. They're also designed for us in surgery when we're doing something to protect what's in our mouth from falling inside you when we have you open and we're doing surgery. But these are not the general population end all be all. Ask this very simple question. We quarantined and locked down the planet. We put masks on just about everybody. And yet, the virus is still around and it's still spread.
Right.
Please explain to me the logic behind that. Use something for the right reason. It doesn't matter whether it's a mask, a drug, a test, or anything else. If you do not have an intelligent reason for doing it, and if doing it does not result in you changing what's going on, you shouldn't be doing it.